Welcome back to ABC-7 at 4. I'm Sam Harris-Samoa. September is Urology Awareness Month, and today, ABC-7's medical contributor, Dr. Ogechika Alozie with Sunset West Health, is going to talk about the things you should watch out for when you go to pee. Now, Dr. Alozie, the chances are pretty good that you could have a urological disease in your lifetime.
Yeah, in general, about half of all people at some point in time will have a urological issue. Now, it's not really necessarily that you're going to need a procedure or a stent or a whole host of other things, but there's a long list of things that you might not want to see a urologist about.
Now, let's talk a moment for about having a leaky bladder or incontinence.
Yeah, so I think one of the things about that is it increases as you get older. And so as you get older, these are some of the conversations that you need to have with your primary care provider. One of the other things about it is that it's embarrassing, right? People don't like to talk about it. And so a lot of people, as they get older, they start to leak. They may dribble. They may have some issues with an adult diaper. Nobody wants to hear that. But that's especially when you want to talk to your primary care provider and then get referred to a urologist.
And doctor, one warning sign there may be a problem would be blood in your urine.
Yeah, that's never good. If you ever see blood in your urine, that's an immediate trip either to your primary care physician or potentially the ER, depending on the volume of blood. It shouldn't be there. You need to get tested. At the very least, get what's called a urinalysis to see the kind of cells that you have and potentially go to your urologist to get scoped.
And doctor, talk to us about the risk for prostate cancer.
Yeah, so it's usually as you get older, right? So people can get prostate cancer, and one of the things is that when you get above a certain age, I think it's 70 to 75, almost 80% of men actually have prostate cancer. Now, it may not be a prostate cancer that ends their lives or needs chemotherapy or surgery, but it's important to get checked. You can have a family history, you can be overweight, it affects 1 in 8 men. I don't want to focus only on men though, right? Because women have urological issues as well. It's unfortunate, but most urinary tract infections actually happen in women, and about 60% of all women by the age of 50 would have had a urinary tract infection. And so these are also some of the things that a urologist can help along with your primary care doctor.
And doctor, finally, we have a research that you can turn to besides your doctor.
Yeah, so there's a lot of resources in the city. Rio Grande Urology is by far the largest group. They have 15 physicians and another 15 advanced practice practitioners. And so they go to all the hospitals in the city. Now again, there are other places that you can see a urologist, but if you want some of the best care, I think it is important to go through them. Go to your primary care provider first and get a referral.
All right, that's ABC-7's medical contributor, Dr. Ogechika Alozie. Sir, thank you so much for your time.
Thank you.